Let me move now to Minister Pavalkis. Minister Pavalkis is Minister of Education and Science here in Lithuania, and on top is a medical doctor, a very prestigious medical doctor as well. So we wanted to have your perspective, Mr. Pavalkis, of this issue. Indeed, education, indeed, training, indeed, science and innovation are very much at the core of this sustainability and efficiency. There are many, many questions I like to ask you. One of them is the issue of the skill mix. Looking at our research, the research we've been doing together, a skill mix is changing the skill mix is central to the reforms to improve efficiency. There are many tasks that can be shifted from doctors to nurses to other allied professionals. However, all the member states here are facing the issues of coordinating well with you, with the Minister of Education, ensuring that the Minister of Education provides the kinds of experts, the kinds of professionals we need to make these reforms. We need to train these people to make these kinds of efficiency changes. What is your perspective? I know you've been working very hard on this area.
I need to improvise and to say that it is not a question about mixing skills. It's not only in medicine. If we go through the ICT sector, if we go through the technology sector, if we go through our higher education system in Lithuania, we clearly see that it is not stratified by the responsibilities. It was a huge meeting on ICT in Lithuania with more than 6,000 attendees. So main question was, should we prepare all ICT specialists in the university settings, or we should prepare them like 75% in colleges, or we should prepare like 50 in the vocational training institutions, because they will be able to fulfill requirements from the employee. So they will do not research or some science on the ICT. They are just working as ICT maintenance specialists. So it was very important, I think, and it is clearly translates into the medicine. I think we, with Minister of Health, discussed about establishing more senior, like it's in UK, nurse consultant, something like this, to put some obligations from the doctor, some responsibilities from the doctors to the nurses. Mm-hmm. It is not probably nice to say that, but they are cheaper. They are more friendly probably with the patients, not so busy with a lot of papers, and they could serve as a really good tool in helping all health care system. So I understand this quite simply. We need to prepare so many doctors and nurses with good skills as we need it. And using opportunity you gave me the word, because you will not give me later on.
I will, I promise, I will.
I would like to reply to the commission report. It's changing very clearly in European settings from the knowledge-based economy to the skills-based economy. And if to talk on OECD context, if to talk on competitiveness council, this changes is very interesting, because nobody now, from the employer's point of view, they don't want any knowledges. They say university degree, what I have out of this? I need the man who could do this, no, that and that. So, you know, it's a interesting translation of the ideology of European Union from knowledge-based to skills-based. And even we discussed very interesting topic on the ministerial level in the Brussels about how to measure outcome of education and research. So we are talking now not that education ends in the giving people a diploma. We should look what impact on his career, on his salary, on his advancement in the position in the company is going. The same with the research. We are not talking that the good article is the end result. No, we are saying that the good article should lead somewhere, and what impact on the society, on the industry, on the new developments of new technology has. And so Irish are first among this, but probably all recommendations in European Union level will be given to all member states, like recommendations. So if you promise, give me another word,
I'll give you actually, I very much like the idea, and as I suggested to all of you in advance, that you interact on these various issues. So we discuss some possible questions. To some extent, to a large extent, I'd like to have a follow-up question, which I hope is in your briefing, but you don't need any briefing clearly because you addressed the first question impeccably well, is the issue of innovation. You were saying it's not articles and research and development per se, but how does innovation, it makes a difference in society, increase efficiency. And clearly, that's very much our challenge in the health systems, that a lot of innovation does increase efficiency, does bring jobs and development and research, but not always increase efficiency. How you deal with that from your ministry?
We deal on the scientific level, and we had some meetings on GRC settings in Brussels about how research translates into the action. So what I can't remember who said exactly that, but it was very interesting the data that for the first we should make a basic level of the care. About healthcare talking. So it means that it should be baseline of the standard what we should have in the European Union, about was said before from the podium. So only after having certain level of quality and standardization, we can talk about updating with innovation, with robotic surgery, with something else. But if we have no real, let's say in cancer, we have no real stage establishment before decision to treat. So we will be doing a lot of very expensive job, a lot of expensive chemotherapeutic, but we will have no effect at the end stage of this whole process. So some standardization is, I think, very crucial in our discussion.
Excellent. Thank you very much.